Good morning, everybody. Thanks for your patience as we switched over from Michael's screen to my screen today to be able to talk with you a little bit this morning. I want to echo Michael's greeting to you this morning and just a very genuine welcome back, and thank you for all that you've done to support children during these difficult days of transitioning through COVID. As I was driving in this morning, I was reminded of a start of a school year for me on my last year as a principal, right before transitioning here to New Albany. I had just before that year, I'd had a student named Jenny who was kind of a rough and tumble kind of girl. And she came to school all dressed up one day with her hair all done and a nice dress. And so I complimented her and said, "Jenny, you look lovely today." And her response was that she hated wearing a dress and that she was having a bad day because she had to dress up. And I kind of let it go, and she walked down the hallway and was greeted by someone else who complimented her on how nice she looked, and she sort of grunted at them. And so as we were kind of walking down the hallway, I said, "Jenny, I know you're not enjoying it, but you really do look nice today. And when someone gives you a compliment, you might want to just consider saying just a really simple thank you." And then she walked on down to the class and went in. And then the summer went by, and then we had the start of the school year. It was the first day of the school year, my last year as a principal. And Jenny came walking up the sidewalk, and I greeted Jenny and welcomed her back to the school year. And she said, "Mr. Hood, you're the best principal that I've ever had." And well, I'd had Jenny the whole time she had been in elementary school. And so I said, "Well, Jenny, I'm the only principal that you've ever had." And she asked me to sort of lean in close. And when I leaned in close, she said, "Mr. Hood, when someone gives you a compliment, you might want to just say thank you." And it was just a really cute experience that just reminded me of what an impact you have as teachers with children. They listen to you, they're guided by you, they look to you and want to follow you. And so as we just start this school year, I just want to say thank you for all that you've done in preparation for this year and all that you're going to do as we invite them back in just a few days. We thought it would be important, though, as we walk into that setting and as we welcome children back and making sure that they feel comfortable and safe as they return, that it would be a good time to review what's been happening in the last 6 months in relationship to safety and health around our campus. And that's the purpose of the day, is just give you some good information, help you feel well informed, and to welcome you back with confidence. One of the first things that we did here as a district under Superintendent Sawyer's guidance was whenever you're really leading anything, there needs to be sort of a knowledge base to lead from. And we have a knowledge base around safety from a school district standpoint, but when it comes to an international pandemic or specifically a virus, we wanted to lean on people who had a knowledge base that could help us in our decision making and help us guide us as we look to where we want to go. This is our COVID-19 task force that Superintendent Sawyer's put together. They have some of the lead professionals in the Columbus area when it comes to truly understanding a virus and how we can sort of function with it. And so I wanted to start off just by doing two things. One, thanking this group. They put tons of time and energy into conversations. You probably saw videos over the summer that they helped produce, but we were in regular conversations with them, constantly talking with them, trying to get guidance from them. And I just a very genuine thank you to this whole group as they shared their expertise and their knowledge in helping us. And then the other thing I wanted to let you know is to give you confidence that everything in our safety plans, everything that we've been doing in terms of decision making, and I mean, we've been way down in the weeds too, looking at the really fine details of kind of what this looks like on our campus. Everything that we've been doing around those decisions has been in collaboration with both the Franklin County Public Health Department and the Commissioner's Office and this task force group. So wanted to just give you confidence that nothing's been sort of a knee-jerk reaction to where we want to go, but it's all been very thoughtful and purposeful, and then has been candidly approved by this organization and this group of this task force, as well as the Franklin County Health Commissioner. So let's just start off by saying, what does this mean for us, and what does it look like for you and I as we have the alarm go off in the morning and it's time for us to sort of head to work. Michael touched on this earlier in the day, but we want to make sure that we're doing a self-assessment at home. and that we're taking a good look at our own health prior to coming to campus. And there's some essential things there that have shifted slightly over the last 6 months since we first sort of came into contact with COVID. And we just want to make sure that you're looking closely as that each morning. So we are asking that you take a temperature each day at home and that it be less than 100 degrees. If it's 100 degrees or higher, we're asking you to stay home. The interesting part about this for me is that when you get up in the morning and you feel good, the first thing on your mind isn't to take your temperature. So I am asking you to sort of be vigilant about this and to be committed to looking at a temperature and some symptoms prior to leaving the home. The symptoms wise have shifted slightly on COVID symptoms. So right now they're listing 3 symptoms that they list as sort of a high risk sort of symptom that you want to pay close attention to and seek attention right away from. The 3 that we have right now that they have going that are most commonly found in identified patients would be shortness of breath or some kind of respiratory distress, loss of taste and smell, and what's described here as a persistent dry cough, I would even describe as a new cough. So we all know folks that have coughing as part of kind of a regular part of their day. So it's either maybe a part of the allergies that they deal with, or maybe there's a medication that they're taking that has a side effect of a cough, but this would be specifically looking at a new cough. And then the one that they're identifying as kind of the number one that they're seeing regularly now is this idea of loss of taste and smell. So if you get up in the morning and you can't smell the coffee pot brewing, our recommendation would be that you take it seriously and contact a health professional to see if you could have that checked out. Then they've got these lists here that are kind of these more sort of common symptoms that we might see in other places other than COVID, like maybe with a common cold. And so they're asking here that if you have 2 or more of these symptoms, then we want you to stay home as well and seek attention. So if you wake up with, let's say, a runny nose, this certainly doesn't mean you have COVID, but if you wake up with a runny nose and you have chills, then we want you to stay home and take a look at it. So if you have one of these 3 up here that are kind of the big ticket ones now, or if you have 2 of the less or lower risk symptoms, we're asking you to stay home. And then as you're home, we're basically saying that we want you to be symptom free before you would return to school. So like we'd mentioned before, it doesn't necessarily mean that you have COVID. It just means that you might have some of the characteristics that are there. And so we're asking you to be symptom free before returning to school. And then in some situations, seeking health professional guidance as you're sort of checking it out. And then we're asking you to be conscientious if you've been in contact with anybody who has COVID symptoms or has traveled and been connected with anybody with COVID symptoms. In addition to that, Michael had mentioned that there's sort of a travel piece that we're going to be watching the state of Ohio on. This one actually has changed here recently, just in the last couple of days. We've had a change with the CDC that has been looking at lowering the restrictions specifically around travel. And but our commitment is that we'll be following the state's guidelines here. Whatever the state of Ohio chooses around that piece is what we'll be following. And then we're asking you that if you've been in close contact with anybody who has COVID or is experiencing those symptoms, that we're asking you to stay home while you evaluate what your exposure to that has been. The interesting part about this from a Franklin County standpoint is that Franklin County Public Health asks for us to consider exposure to be closer than 6 feet for more than 15 minutes. So let's say in this situation, maybe you've got a situation where you had a family outing that you went to, and then a couple days after you've been at the family outing, you find that one of the family members has been identified positive with COVID. The Franklin County Public Health perspective would be that's when you need to start thinking about contact tracing and were you closer than 6 feet for more than 15 minutes? And if so, they're considering that an exposure, and then they're asking you to follow a quarantine protocol related to that. And then just to be safe too, we're asking if you've been in contact with anybody that's been identified with flu, because flu can be so closely related to COVID symptoms, we're asking you to monitor that as well. We've also got an at work kind of piece. So all those things that we just saw were happening before you come to school. They're happening at home. You're monitoring your health at home. And then after you come to work, we're asking you to also then commit to some safety protocols at work. The first one being just socially distancing, trying to honor that idea of distancing as much as you can. If I think about, what's it look like, let's say like in the parking lot when you come to work in the morning, you certainly want to greet each other and still be investing in relationships with each other, but try to honor a distancing situation in that process. And maybe to give you a sort of practical ways of what this looks like. Just this week, my office is right across from Superintendent Sawyer's office. He had something that he wanted to say that was probably handled better in person than on the phone. And so he stood at my door while I stayed at my desk. He was masked at the door while I sat at my desk. He was far more than 6 feet away to share that information. And that's a great example of where we just want to try to honor it. Another example for me would be Nate McCarville and I had to do some work that required us to travel across campus on a golf cart. And so just to try to honor it the best that we could, I sat in the front driving the cart. Nate sat in the back of the golf cart facing the opposite direction. So those would just be sort of practical things that we're asking you to do to honor the social distancing piece. Washing hands frequently is something that you're going to hear a lot about. There's just tons of science behind that. They would say that if you wash your hands with water only, that you're probably just going to be moving the virus around on your hands a little bit. But if you wash your hands with soap and water, or if you use hand sanitizer on your hands, that it actually breaks down the structure of the virus and more or less kills the virus. And so there's a high emphasis on just sort of being committed to regularly washing your hands and regularly in your schedule of the day, finding time when you can go and either sanitize or wash your hands. Covering your mouth and nose, I think we do a pretty good job of that already, but just be conscientious that if you do find yourself having to cough or sneeze, the virus is spread through our droplets traveling. And so we want to restrict our droplets traveling. And whatever you can do to cover your mouth during those times would be great. We'll be talking in detail about facial coverings. There is a governor's order that we're required to wear facial coverings when we're out in public. That includes here on campus, and we'll be talking about that in detail. And then we want to encourage you to restrict the use of shared equipment. And so simple things like if you're with another person in the office area, not asking to borrow their pen to sign a document, or to avoid sharing someone else's computer keyboard, as example. But also there's times I know where we may have spots in the classroom where we want to restrict shared equipment as much as possible. Like let's say that common bin of markers that we used to have in a classroom, but there might be times in art class where it's a situation where we have to share a piece of equipment. If that's the case, we want to make sure that it's equipment that can be cleaned and sanitized. Everything else we want to try to avoid sharing. And then just to reemphasize what Michael has said earlier is that if we could just have a commitment to letting a supervisor know when you're feeling unwell. I know as teachers, we tend to have this characteristic that we want to just come to school and we want to serve children well. And I can think of a number of times over the course of my career where I came to school to teach feeling unwell. And because of the fact that we are in a pandemic, because of the fact that we want to have a high respect for COVID, we're asking right now that you just truly honor that. Let a supervisor know, either from home, that you're not coming in because you're unwell, or if you start feeling unwell at school, we're going to contact a supervisor immediately. And we're going to talk about that more here in just a moment as well. By the way, your administrators have this presentation today. And this would be an example of a slide where a couple of things are connected. So connected to the Eagle Health and Safety Compact up at the top is the actual document. If you want to look closer at that, you'll be seeing that coming out in e-collect forms here soon. It's just taking both this before and after work commitment and just sort of honoring to say that we're going to be in a compact together to say that we're going to stay true to these safety protocols. And then there's also a reminder on here that there's also going to be a public school works module coming your way that'll give you more information on COVID specifically. I've actually gone through that piece and it has some really kind of interesting information as to how we can do this well at home and some sort of practical information around COVID. So be looking for that as well. So the goal really is that we want to try to mitigate COVID as much as we can. I was in a meeting a couple of days ago with a Columbus Fire Department battalion chief, and he was just having this sort of honest, candid conversation to say, you know, until we have a vaccine, until we have a little bit different setting, COVID's not going away. And so we have to figure out how do we live with it, and specifically, how do we mitigate our risks around COVID as we return to campus. And that's where we want to spend a little time now talking about the details. Our task force has said repeatedly over and over that the answer is in multi-layered mitigations. No one layer really stops it completely or protects completely, but facial covering, as an example, is something that they've described as kind of a #1 mitigation tool or protocol that they feel is significantly important, where it's protecting others more than it's protecting us, but it's one layer in that process. And then when we add hand washing to that, which is a protection for us personally, and then partner that with socially distancing from others, knowing that droplets can't travel far, and then put cleaning, disinfecting with that. As we put those layers together, that's when mitigation is truly effective, and we start to see that we have a positive impact on the control of COVID. That's kind of our framework as we've sort of gone through thinking what's our protocol going to be like here on campus. Michael shared this slide with you, this community effort that is wanting to do sort of a kid-friendly advertisement of what are we looking at as top mitigations. And our task force would name wearing a mask as #1. That if we all wear a mask, which is a governor's order right now, if we all wear a mask as we're going out into public and into school, and then if we all are washing our hands and making sure that we're doing our best to keep the virus off of the things that might be close to our face, and then if we back up and socially distance, that we will be able to control COVID within our campus. You'll see a lot of these posters around campus and signage that's connected to this campaign. So let's just start with that first one, the mandatory facial covering. It is a governor's order. It's a governor's order for when you're going out in public. You're not required to wear it in your home, but if you're leaving your home and going out in public, they're asking you to wear a mask. If you are indoors, we're asking you to mask up. The only time that you would be really allowed not to wear a mask would be if you're on your own in a space like I am right now in my office, where I'm the only one here. Once I leave my office and I go out into the hallways of the administration building, I want to make sure that I have a mask on in honor of others. Not so much in the protection of myself, but in honoring others, that my droplets then are being contained. We want you to mask up when you're unable to maintain social distancing outdoors. So if you're outdoors and you are in a socially distanced setting, let's say we're one of the grounds crew guys that are mowing the grass out in the middle of a football field, that wouldn't necessarily require masking. But if we're in a setting where we can't guarantee or maintain social distancing, like I might run into someone, or I might be in a situation where I pass someone, then we want to be honoring of that safety protocol and wearing a mask. Recently, though, we did get information that said a face shield specifically cannot be worn in lieu of a mask. We were thinking that they could originally. That's been shifted now. They're asking you to specifically wear a mask, and we're going to be talking more in detail about that. Face shields could have an exemption, but they are really limited as to who that would be. Face shields are allowed to be worn with a mask. So if you would have that desire, face shields can cover up eyes as an example, but they cannot be worn on their own. They have to be worn in connection with wearing a mask. And then we are asking, just because of surely being able to sort of manage this, we are asking that employees bring their own masks daily, and unless you're qualifying for an exemption. And once again, the exemptions for not wearing a mask are highly limited. And if you would qualify for one of those, we are still asking that you wear a face shield in that setting no matter what. But we are asking you guys to wear a mask. If you would forget a mask on a given day, we have masks that we'll be able to provide in that setting, but we do not have the capability of providing masks for everyone every day, and are asking you folks as employees and our students to be coming with masks daily. If you've got more questions or more information needed, we do have a facial coverings fact sheet that's available to you, as well as the board policy to give you more details on any of that. My wife's a first grade teacher, and a friend of hers on social media sent this cartoon a few days ago that we thought was, clever. They must have liked the one down here in the corner because they've got a circle around it. But the interesting part for me was after we got this cartoon, we went to the grocery store that day, and I think that we saw all of this displayed in one trip to the grocery store, where either someone had a mask pulled down below their nose, or they had it completely down under their chin. At the store that day, there was a brother who wanted his sister's mask, and so he was ripping the mask off of her face. So this is something, if you've been out in public at all, you've seen that we're not always properly wearing our mask. And so we wanted to address that, and just to remind you that as we come to campus with masks, this is kind of a new experience for us being together in this way. We want to make sure that it's done well, it's done safely. So the Center for Disease Control is asking that you wash your hands before you put your mask on, and then they're asking you to be conscientious about using your straps to get your mask onto your ears and onto your face. And then once you've got it onto your face, they're asking that you form it around your nose and that it fits securely around the sides of your face in order to control droplets as much as possible. You want to be able to breathe easily in it, but you also want it to be a firm, sort of snug fit. Connected to this, if you all look at it later, connected to this slide is also a YouTube video of a registered nurse kind of showing what that looks like, and making sure, if you have an interest in maybe directing children to specifically how do you put masks on and off. They call it don and doffing a mask. And then just a thought about what do I do when I take my mask off? I want to use the straps again to take it off, and I'm going to lay it on my desk, but I don't necessarily want to lay it directly on the desk. So they're really recommending that we fold it in half so that the inside's protected, and then lay it on a paper towel or a Kleenex or something like that, that would give an opportunity for it to stay in a more sterile environment before you return to putting it on again. So Duke University did a significant study specifically on masks and their effectiveness. And this is a slide that gives you a really brief summary of what that study showed. They started by looking at wearing a variety of different kinds of masks and then having people say certain phrases. And as they said certain phrases, they measured how many particles were able to sort of escape through the mask in order to try to define what masks are most appropriate for wearing in public. As you can see from at the top of this slide, cloth masks did well in capturing particles and keeping that from spreading. It's all based on the quality of the cloth, I guess is the best way to put it. If it's a tightly woven cloth, it's obviously going to be stopping more particles than if it's not. Surgical masks are the ones that look kind of like this, that are three ply and are pleated, and those did even a better job of protecting droplets from escaping. The mask that they had is at the highest level is one that we're not going to be asking you to bring to campus, and that's the N95 mask. So the N95 mask, the N stands for a credentialing group called NIOSH, and the 95 is referencing the fact that it's stopping about 90% of everything with that mask. And so we're really reserving the N95 masks for those people that are working closely in the healthcare kind of realm. So we do have a few N95 masks here on our campus that we're reserving for our clinics and for our nurses as they work with people that might be symptomatic. But overall, N95 masks are things that should be reserved specifically for those. Then we get into 4 masks that they found to be basically kind of ineffective in stopping droplets. The first one was masks that have a vent. And you've probably seen those before, a cloth mask that looks like it's got a little round vent on one side or possibly both sides. And that's the purpose of that, is to help you breathe a little bit better. And what it does is it protects things going in. It's filtering things going in, but it's letting you exhale at a greater rate, and therefore droplets coming out at a greater rate. I've got a brother-in-law that's a triathlete, and he often will wear one of those masks when he's on the bike portion of the triathlon, because it's controlling, let's say, pollution from cars and things like that might be coming in while he's breathing, but it's allowing him to exhale at a greater rate. And so we're asking no mask with vents to be used at school. And then the bandanas, scarves, and gaiters, those were ones that as they were doing this testing, and again, the testing here was them having someone say a statement and then measuring how many particles were released through the bandana or through the scarf or the gaiter. They were labeled as being fairly ineffective. This is a great example of where we've been interacting with our task force. We've been asking them to partner with us, and what do you suggest, as we talk about inviting people back and wearing masks. And right now their suggestion is that masks with vents or valves, bandana, scarves, and gaiters are not permitted for a school setting because they aren't fully effective. We do have an email out to them actually today to talk about gaiters as an example that offer to put a greater filtering source in there. And so we'll update as that goes. But as of right now, we're asking that those ones that have been identified as being at a lower quality or a poor quality of being able to stop droplets or particles, we'll reserve those for someplace other than school. Let's switch over then to hand washing as the next mitigation that's really there. So if you think about the Eagle poster, we've got the mask up, now we've got the wash up situation. And there, like we had mentioned before, there's just tremendous scientific research indicating the effectiveness of washing your hands. And so we're just encouraging you to be very purposeful, maybe even on your phone or in your plan book. Scheduling in time where you can personally wash your hands, or where you can have children to be able to step out to wash their hands. We have pump bottles that are being supplied in your classroom. They're gallon-sized pump bottles that have hand sanitizer that are going to be available to you and your students in your classroom to use. And then we've ordered large 55-gallon drums of the hand sanitizer to be able to refill those gallon containers as we go. And this would be true not just of classrooms, but they're going to be provided in office spaces as well. I think we ordered 700 gallons of this stuff to be able to go around campus and pretty much be available in any space. In addition, the picture here shows that we have hand sanitizer stations located across campus, mainly in high traffic kind of areas. But we specifically, in addition to ones that we already had, we ordered up between 60 and 70 new hand sanitizing stations that are portable and that can be moved to the places that are where they're most needed. So as you are in your building, and as administrators, as you're seeing the flow of traffic come into your buildings this year, if you see the need to move one of those portable hand sanitizing stations, you're welcome to do that, because we want them to be in the spaces where they can be most effective and best used. On each of these, by the way, on these mitigation with masking up and washing up and backing up, we've got YouTube videos connected to these slides as well that you could use with children to just emphasize these points. And then the third one is that backup one, or the social distancing. We want you to adhere to it whenever possible. The task force is kind of inconclusive on this, looking at 3 feet and 6 foot distances. So we've got 6 foot that came out originally. Then we've got an American Pediatrics Association that came out with 3 foot. Our leading researchers that are kind of in this day-to-day kind of researching around this would say that there's not a significant difference between that. And so if you think back to that poster of the eagle with its wings kind of spread, it's using that kind of as a guideline. If you're an arm's length from someone, that's really kind of what we're hoping for. And don't go under 3 and strive for 6 whenever possible would be kind of the guideline, is what we want to do on that. Keeping in mind that exposure is going to be something that's considered to be less than 6 feet for more than 15 minutes. So that's kind of our guideline on that. We've done some specific things then to help with that. So we've rearranged classrooms. We've taken out furniture in many settings. I know that in most settings, we've taken out whenever we can. We've taken out cloth furniture that's not easily cleaned. We've taken out benches and hallways that will discourage kids from gathering together maybe in close settings. Just every place that we have been able to, we've been trying to provide more space so that you can socially distance as easily as possible. This has included ordering some floor decals that are going to be placed in prominent areas. So the cafe lines would be one example of where we'll have floor decals down on the floor to help students sort of visually see how they can stay separated from each other. I know that Richie has also ordered floor decals for the athletic complexes too, as we think about concessions areas, let's say, with people waiting in line for a concession or something like that. So you'll see decals around the campus that are sort of helping with that process, including in some buildings, one-way traffic pattern decals that have been placed in hallways to help sort of monitor our flow of kids and our ability to stay distanced in that process. Here's an example of a floor decal that we're going to see in the cafeterias across the campus that would be looking consistent campus-wide. So signage has also been added in the buildings, and it's underneath this theme of mask up, back up, and wash up. And there's been a number of different things that have happened around signage. So for a lot of it, we've taken the signage that the CDC was recommending. And so as you enter buildings, as an example, you're going to see signage in the front door of those buildings that's making sure that people know if they would come in, that they have to be masked in order to come into the building. By all the restrooms, you'll see signage that's talking and reminding students that they need to make sure that they're washing their hands, not just after using the restroom, but sort of regularly throughout the day. Signage around most of our hand sanitizing stations, and then social distancing signage as well. Some specific signage that has been put together to help just communicate this with our students specifically would be ones like this one, where the Franklin County Public Health, and by the way, we're in conversation with them almost daily on our safety plans here. And when I say them, I mean the commissioner and the assistant commissioner are who we're talking with as we're running our safety plans by folks. They've approved a short mask breaks. So if you think about the exposure rules, less than 6 feet for more than 15 minutes, they're saying you could take a short break in the classroom, but there's a couple of things that have to come into play. One is everybody has to be seated and distanced from each other and have a sort of a commitment to that. And then you could take a short mask break. I know at the elementary level, as an example, that having a snack, even at the middle school level, having a snack is an important part of the day to keep kids energized, and you're able to do that. Have them take their mask off for a short break while they grab a snack. But we'll put signage up that's specifically reminding them kind of what the rules and regulations around that are. And then once they move away from their desk, they need to make sure that they have their mask back on. Here's another example for us of where we're asking kids to come down to the cafeteria. We've got them in approved seating assignments. So we've literally taken pictures of our seating assignments and given them to Franklin County Public Health and asked them to approve if that plan works okay. But we're asking kids to come down to the cafeteria with a mask on. We're asking them to wear a mask at any point that they're up and moving. So if they're getting their lunch from the line, which is going to be a really quick process where they're going to just be coming in, quickly grabbing a meal that's boxed and heading back to their table, they're able to take their mask off while they eat. But then as soon as they're finished eating, throwing their trash away, et cetera, the mask goes back on and they'll be wearing their mask as they transition out to recess. So here's another example of a signage that you'll see coming your way soon. And then the fourth big level of mitigation or that sort of layering piece is the cleaning and disinfecting. And so I want to give you confidence that we've had lots of time and energy spent into making sure we have the right products. We've also spent time and energy in making sure that we have a clear plan as to how cleaning and disinfecting will go. So we do have a plan to regularly clean high touch areas. So if you think of those spots that would be a handrail a doorknob, things like that, restroom areas, those are underneath kind of regular cleaning timeframes. Our custodial staff's going to be following actually a sanitizing checklist that they will use daily to sort of document when they've been to certain high touch areas and to confirm that those areas have been cleaned. In addition to that, each classroom has been given a cleaning kit, or if you don't have it already, it's on the way. And it's going to have a variety of things connected to, and when I say kit, it's not like actually in a box necessarily, but you'll have an area where you'll have several items there that we'll consider to be a cleaning kit that has the hand sanitizing bottle. It's going to have gloves. It's going to have a couple additional masks in case students maybe would get soiled or something and you want to give them a new mask. It's going to have paper towels. It's going to have bottles of cleaner like this. And one of the nice things about COVID is that it doesn't require any kind of special cleaning product. It can just use regular household kind of cleaning products to clean. And then what we're just asking is that we're all in this together. And we're asking you to help with this process in the cleaning and disinfecting. So custodians will take care of the big high touch areas outside of your room. But as specifically as kids transition from your classroom, we're asking that you as a teacher would just spray desks quickly, and then students can use the paper towels to wipe. And that will help us as we think about kids moving from one setting into another setting, that they can get in and have confidence that the space that they're going to has been quickly wiped down. And like I mentioned before, it's nice that COVID has a really simple cleaning protocol connected to it. We are asking that you limit sharing of things that are difficult to clean. So an example for us from a district standpoint is we aren't quite sure how we could safely keep water fountains clean, as kids will be visiting them regularly and filling bottles and so forth. So we're asking students to bring water to campus, and they're going to have it available for them to purchase here on campus. But if you've got something in your classroom that typically is a shared item, we're just asking that you consider whether it's going to be difficult to keep it clean in a shared setting. So just be thoughtful about your classroom and those things that are needed in order to do your teaching and learning. So let's switch gears slightly and let's go to just sort of regular kind of school day mitigations. So we went through the mask up and the wash up and the backup, and let's talk about what's this going to look like on a kind of a day-to-day basis across campus. The first one that we get a lot of questions around here would be around our clinics and how will our clinics operate. CDC guidelines are really asking, we're calling them a well clinic and a sick clinic, but you could have it be just sort of like our regular clinic and then an isolating kind of room would be one way to sort of look at it. But the well clinic will be where we send kids that just need regular old clinic support. We're asking you as much as possible to do those things in the classroom that you can that would prevent a lot of visits to the nurse that can be mitigated, I guess you might say, up in the classroom. So I was an elementary principal for years. And so an example, it's not uncommon for a student to say, I just don't feel well. And so maybe asking them to use the restroom or to take let's have them wait 10 minutes and let's see how you're feeling in 10 minutes. A trip to, a situation where they can just take a moment out of that space if something like that's needed. And then we'll try to preserve the clinic for those things that are regular kind of health needs, taking medications, coming down to support an injury maybe from the playground. And then the sick clinic is where we're going to be sending anybody who is demonstrating that they might have COVID symptoms. And we'll talk more about that here in just a second, but I want to let you know that each building has identified areas, very specific areas that will be identified as the well clinic and the sick clinic. And nurses, school nurses and clinic aides have spent hours talking about how to service children and service you well. And so one thing that you should be aware of is that the sick clinic is for anyone. So if at any point during the day you feel like you're not feeling well, the school nurses and the clinic's aides are going to be willing to support you as we sort of walk through that together. We've been very intentional about making sure that they're set up well. So they have personal protective equipment down there that would be ramped up a little bit, where they've got a variety of masks that they can choose from. They've been given clinic gowns that they can wear in an isolation kind of space. They've got very clear protocols in terms of expectations around parents picking up children and things like that. We've been working closely with Franklin County Public Health and Nationwide Children's Hospital to develop kind of a flow chart or an algorithm of what this looks like. And that's going to be coming soon. We've already got a model kind of in place that we're not sharing necessarily today because we're having our task force take a look at it and just verify it for us. But I want to give you confidence that there's been tons of discussion around how do we support a situation where either a staff person or a student's not feeling well. So here's an example of a flow chart that's come from the Educational Service Center of Central Ohio and some superintendents, more or less, sort of coming together and talking about the need for a general kind of game plan. It's not the one that I was referring to a minute ago from Franklin County, but it's kind of a general flow chart of how this would look. So in this situation, it's asking, what if my student has COVID-19 symptoms at school? And so this one is suggesting that when a student starts to feel unwell, the teachers are going to make sure that that student is masked if they're not already wearing one. They should be wearing one. But if they're not, they're going to mask them and then they're going to send them to the clinic. The clinic's going to do an evaluation right away when they come to the clinic, including taking a temperature and then asking them about symptoms. And if they're symptomatic from a COVID standpoint, the student's going to be going home. They're going to be isolated in the sick clinic, and the parents are going to be coming to pick that student up. And then you've got these arrows down at the bottom that sort of show you, okay, what happens then? They go home. Our suggestion is that they are contacting a doctor and potentially getting a test. Let's go to the right here. If it comes out and the test is positive, then the parents notifying us of that test result, and we're starting a contact tracing kind of situation to see, okay, who have they been within 6 feet of for more than 15 minutes? And we're going to start that kind of process to help stop the spread of any kind of a positive ID. If they test negative, this is the line coming down the middle now, if they go to a doctor and they test negative, then we're basically back to where we were in all of our years as clinic nurses and school professionals, and that we're just going to ask them to stay home more or less until they're symptom free, because it could be a cold or it could be allergies or any of those sort of things. We'll ask them to stay home until they're symptom free. And then if you come to the left now, the situation where what about the parent who elects that I don't want to have my student tested? In that situation, our assumption is that the student has COVID, not because of the parents choosing not to elect, but because the safest thing for us to do is just to assume that the student has COVID. And so they'll immediately go into a quarantining situation. And that's what that arrow is describing, is that student, along with siblings that might be in our district, will go into a quarantine situation where we keep track of it, because this COVID virus does have about a 14-day window where it can kind of incubate. And so those folks will go into a quarantine situation while we observe for symptoms. What if a staff member would test positive? So this is a situation now where you've been exposed, from anywhere, the grocery store, any place where you may have picked something up. Although the numbers are going down in Franklin County and we're looking better and better every day. And we are trusting that you're going to be making family decisions that are going to sort of limit your exposure. If you would find yourself in a situation where you would get exposed, you're going to call your building administrator immediately. And then the building administrator is going to contact human relations or human resources department. And then from there, we'll work hand in hand with Franklin County to specifically go through the contact tracing kind of process. And one of the things that you might be interested in knowing is that it kind of leaves our hands to some degree at that point, and Franklin County kind of takes over and starts walking through that contact tracing piece, making sure that they've done everything that they can to support that identification to make sure that it's not spreading. Let's talk about lunch and recess. We're in a situation where we've spent tons of time talking with our cafeteria and with school buildings about recess and lunch protocols. They've been very intentional about developing cohorts of kids so that kids sort of stay in smaller groups and travel in smaller groups throughout the day. So if we would have a COVID identification, we've got a smaller group that there may have been exposure to. They've assigned seatings in all the classrooms and in the cafeterias, on the buses. Each place where we have students that we know are going to be sort of sitting in regular spacing, we're assigning seats so that we know exactly who they've been next to, and we'll make contact tracing really easy if we would need to go down that path. Students are being asked to bring water bottles to campus. And so most will probably be just coming with just kind of regular water that they can use throughout the day. And then it's going to be available for purchase specifically at lunch as well if they need more. And we'll continue to monitor that from a Franklin County standpoint in relationship to our water fountains. Our desire would be to provide that as quickly as possible, but we're going to go off the guidance of our health department on that one. And then you should be aware that your recess areas then have been broken down into zones. We've got signage that's been ordered and that should be here in the next couple of days that's breaking down zones in your recess areas. So the ELC, as an example, has a couple spots that they've identified as zones. The primary 1-8 kind of playground, I think, has about 7 zones that they've identified. We'll be equitable in terms of having kids sort of travel through zones on different days, but it allows them to stay in cohorts that way. And again, limit that exposure over time. Arrival and dismissals had a lot of thought and consideration as well, including staggering entry points for students and then kind of limiting travel both within the building and between buildings. So if I use the intermediate just as an example here, although these conversations have happened everywhere, but the intermediate for me would be an example of it's a building that's broken into more or less kind of 4 wings. We've got, and they've done it off of the Eagles Rise kind of commitment, but they've got an R wing, an I wing, an S wing, and an E wing. They've identified entry places for each of those wings. So if you think about buses coming into our bus lot like they normally would, a typical year, kids will all gather in kind of a funneled way coming into the front door. And now this staggering allows us to have them enter in different entry places and spread out the students a little bit so that there's a little bit less close contact in that way. Interestingly enough, that same exposure piece comes into play in situations like this. So if you think about, let's say, fire drills as an example, I spent quite a bit of time talking with our fire chief here in New Albany, as well as a state fire marshal, about how do we do fire drills in a setting like this. And they use the same protocols as Franklin County Public Health. They're saying close distance for more than 15 minutes. And so they're saying, as an example, when you're exiting for a fire drill, have a commitment to socially distancing when you get outside and you start to keep track of your students and see who's out there and taking attendance. But as they're cramming through the doorway, as they're coming into that egress where they have to exit a building quickly, they expect that's what's going to happen if we would have a fire. And as long as students are masked and moving quickly, they don't have great concerns. Same thing with our entry here. If we can put them into staggered entry points, we should be just fine with masked students coming through those spots. Transportation's same situation. Numerous meetings with health officials and transportation officials across the state of Ohio to put together a game plan for how we can do this safely. We've drastically reduced the number of students on a bus. We've assigned all students seating that is going to be honored and allows us to, again, contact trace. We've got 2 kids per bus seat. And then families that have siblings together could potentially put 3 to a seat. Facial coverings are required at the bus stop while you're waiting for the bus and while you're riding the bus, and that includes the driver. Social distancing is going to take place as students are waiting for the bus. We'll have high expectations around that. I'll be one of the people that'll be stopping by a number of our larger sites to make sure that that's being honored. And then you should be aware that buses have a really clear cleaning protocol where they're going to be wiping down every seat at the end of every route and as well at the end of the day. So for some of our drivers that have midday routes, I'm talking about cleaning a bus maybe like up to 8 times where they're wiping down every seat that was sat in. So just want to give you confidence that there's lots going on to make sure that we're doing that as safely as we can. When we get into things like athletics and performing arts, we're following the Restart Ohio guidance that's been provided us through the state of Ohio. It's remarkable in terms of the details around this. So the athletics, as an example, just a week or so ago came out with a 12-page order of just sentence after sentence of detail of what has to happen in order to safely put on an athletic event, and they're being followed closely. I sat in a meeting for, I think, about an hour and a half with Richie and the Franklin County Public Health Assistant Commissioner last week, just going over those details. Richie going over every single detail of every single venue that we have here on our campus. And so once again, I'm really just saying that to let you know, we are way down in the weeds. We are in a situation where we're looking at the finest, minute details of some of this. And I'm hoping that gives you confidence that it's been a very thoughtful process. Same thing with performing arts. They've been really conscientious about what are the rules around singing, what are the rules around playing an instrument, and how you do that safely. Facilities, just in general, then, are going to be really limited as to our situations here. We've got rental groups are going to be highly limited. We're going to be more or less saying no to visitors and volunteers unless they're considered to be essential. We have heightened our air filtration systems in our buildings. The MERV that you see there, the MERV 11 to 13, is basically a standard that's looking at sort of minimum efficiencies. It's a rating system. A normal household would have a MERV rating of about a 7. And as you go up in the number system, that goes up to 13, 13 is the highest. It's basically talking about having more restrictive filters than in terms of how many particles can get through. The challenge when you get up to 13 is that those filters are so restrictive that they actually start to have a negative effect on the working of your actual heating and air conditioning. And so you have to sort of match the filters against your system. But I'm letting you know we have a high level of filtration that we've moved to here in our district, and I want to give you confidence in that piece. In addition to that, we've worked with one of our task force members that's an environmental engineer, and have worked closely with them to talk specifically about the circulation of air and making sure that we're drawing in outside air that then circulates on a regular basis as much as possible to make that environment as healthy as possible from an airflow standpoint. We're asking that interior rooms remain open as much as you can. I know that won't always be possible, but if you can, the opening of those doors will keep the airflow going better. And in the same respect, we're asking that the exterior doors and windows remain closed, because then that allows our ventilation and the mechanical system to work properly. And then one of the things that I think might be interesting for you to know that maybe not all of you know, because this is not true of most districts, we do have a service manager on site every day managing our heating and air conditioning. So most school districts are having to go out to an outside provider and having to wait for assistance and so forth. And we're very fortunate to have someone who can monitor this quickly and effectively right here in our district. Interactions that are sort of taking place throughout the course of the district, we're encouraging you, especially in nice weather, if you can get outside and use facilities outside, we think that's a great idea. Michael had mentioned earlier that the city was quite generous in helping us put in 2 new pavilions on our 1A playground. They're amazing. They've got permanent seating in there that's been distanced appropriately. They've got these gigantic fans that can cool that space for you. They've been provided with electricity and Wi-Fi, or will be provided with Wi-Fi, and are going to be just a great opportunity for a learning space if you would choose to do that. Those will be available through FMX, where you could go in as a reservation kind of system and make sure that you've dedicated time to those spaces if you choose to do that. And then just a reminder again that we're going to be limiting anybody coming in the building that really doesn't have to be here. We understand that there will be times when people that need to come in. Let's say a refrigerator in the cafeteria needs repair. You know, there's times when we're going to need people to come in the building, but those folks will go through the front office and go through just a really brief health screening. All of our offices have thermal or infrared thermometers that take a quick temperature rating, and then ask a couple quick symptom questions to make sure that the people coming in are appropriate to come in. And then we've adapted, obviously, our choir, orchestra, performing groups have adapted significantly to make sure that they can be doing that safely. And then we're just encouraging all large group meetings like the one we're in right now can be happening virtually. and encouraging that as well, just to limit interactions when possible. So it's just a reminder here, then we've got a situation where we're trying to keep this simple for students, and we're asking them to honor these 3 mitigations, to mask up, to back up, and to wash up. And I think you'll see that signage that goes across campus is going to be a visual reminder to you as well, as you're just kind of going across to the different settings that you need to be in. It'll be just reminding all of us to hold true and to be vigilant around each of those. So Michael had mentioned the R factor in his presentation earlier, and this is just a circle back around to that to to just sort of honor that piece of it. As I was presenting, my face has sort of been up in the corner here while I've been talking to you guys here for the last few minutes, and behind me here, I just sort of just had this visual reminder myself, actually, that I have an eagle hanging on my wall right behind me, and that eagle obviously is a great representation of our district in terms of the New Albany Eagles. I'm proud to have it hanging in that way. But it's even got a more significant meaning for me, in that eagle came to me from a lovely older lady named Elaine Stillwell. When I was 17 years old, Elaine was one of the first people to sort of speak the R factor into my life. She didn't call it the R factor, but Elaine gave me this eagle when I became an Eagle Scout at 17 years old. And she gave me this sort of charge that she wanted me to hang that in some prominent spot so that I could be reminded of kind of that commitment from that Eagle Scout ceremony, of not just the acknowledgement of what had happened and what I'd achieved during that time, but just this commitment that says, John, I just want you to be reminded that you need to live trustworthy, loyal, helpful, friendly. And she kind of just went through those 12 characteristics that Scouts repeat all the time. And what she was more or less saying was, how you choose to live your life today, John, is going to have an impact on what tomorrow is. And so even while I was presenting to you today, just seeing that eagle just reminds me of that's kind of where we are in relationship to these safety protocols, that how we choose to live and respond to COVID today is going to have an impact on the outcome for us as a school. And some of that's practical. So if I think about those wash up and mask up and back up, so that's kind of a practical thing. Like, make sure that you honor this out in the high school parking lot, out in the intermediate parking lot, in the primary parking lot, when you're seeing friends, honor social distancing, washing your hands. So some of it will be kind of owning that piece of it and doing the things that we can. But there's also this emotional piece that Michael had referenced earlier too, for me, that's really important. One would be the sort of the theme song for COVID is going to be adjust and adapt. That's where we're going to find ourselves living on a day-to-day basis as we move forward, and a willingness to just sort of embrace the fact that that's life for us right now, is that we'll need to be able to move easily. And the other one that's just critically important for me is that get your mind right. This thought that you need to have a mindset as you approach this school year that is going to be a positive one, that when students come back and in your setting, that they're going to be able to follow your lead, and that they're going to be see the example that you're giving in terms of an encouragement towards doing all that we can to do this safely together. The statement at the bottom is really where it all kind of comes down to an end, and that's that we are stronger together in this, and that if we honor these safety protocols together, then we're going to have just a great year. So let me finish by just saying again, thank you for all that you're doing. Thank you for the commitment that you've had to kids. When I watched you guys roll back in March, roll quickly into an online setting thing, I was just so impressed with who you are and how you're serving children. And that's my encouragement to you now, that you'll take these first few days here before kids get here to just spend time together talking about how we can serve kids well. And I look forward to partnering with you. If you've got questions around any of this, building principles are probably the first place to start, because so many of these details are related to building specific kind of answers. But if you can't find them there, I want you to know I'm here to support you in any way that I can. And this is just a very genuine welcome back. Thank you.